Hey folks, if you found this video, you're doing what I did about 3 months ago. I was trying to look for some information on ACDF, anterior cervical discectomy with fusion surgery. I couldn't find anything really recent other than one video, so I ran into some things that my research didn't cover that I hope will be helpful for you. Today's January 12th. I had my ACDF surgery on December 28th. I had 3 levels, 4, 5, 5, 6, and 6, 7 done, and then fused with a plate. So my symptoms were pain in the center of my shoulder blade, searing pain in the center of my shoulder blade, and then pins and needles up and down my arm to my forefinger and thumb. Pretty frequent, made it hard to sleep and perform at work. So I opted to go ahead and get the surgery. My surgery took 2.5 hours. One of the things I obviously researched was how many of these go bad and for what reason. So less than 1 in 10,000 go bad. I felt very comfortable with my surgeon. He had done over 400, which was one of the first questions I asked him. So I was pretty comfortable with him and his team. It took about 2 hours. I was first thing in the morning from about 8 to about 10:30. One of the things I wasn't prepared for was I had a hard time coming out of the anesthesia. I had really low heart rate and low oxygen in my blood, so I did end up spending one night at the hospital. So about Tuesday afternoon, I was finally released to go home. Felt pretty good. Had trouble swallowing, which I'm sure your research hasn't covered as well. You know, he's going to cut you open. He's going to move everything over, dig around in there, put the plate in, move everything back. So there's things moving around that don't normally move around. So the anesthesia was hard to come out of, like I said, so I stuck with saltines and ice water for the time I was in the hospital, and it felt like every time I swallowed a saltine, it would get caught up in my throat. Half of it would go down, but half of it would get caught in the back of my throat. That obviously wasn't happening, but that's exactly what it felt like, just so you can be prepared for that. Felt really good. I'm not sure what medications they were giving me in the hospital, but 2-hour drive home, felt really good. 48 hours later, terrible. It was 100% worse. We had started taking the oral pain meds. I was on taking oxycodone and Dilaudid. Everybody kept telling me, stay ahead of the pain, stay ahead of the pain. I didn't have pain that I was trying to stay ahead of. I didn't know that, obviously, because I was taking the meds, but I felt so terrible after 48 hours, I asked my husband to stop feeding me the prescription meds and just to see what happened. I was hallucinating. I had chills and sweats and fever and just feeling, and according to my husband, looking pretty terrible, which is exactly the way I felt. So we stopped everything. Within 24 hours, I felt remarkably better. I was able to eat a little bit more. My husband was great, feeding me, fruit smoothies and chocolate shakes and just things to kind of soothe the pain that I had in my throat. So about 48 hours after we stopped everything, I was really remarkably better. Sleeping was hard. When I got home from the hospital, I felt so good. I tried to sleep in bed, which didn't work out well. I would kind of recommend you either get a lot of pillows or get a recliner, but for the first 5 nights, I was more comfortable on the recliner, just because you can't really move around and roll around. You got neck stiffness for obvious reasons. You need things to heal in there, and because I had a complete collapse of at least 2 of my discs, he put the artificial discs in, and it actually I got back to my normal height, which also meant that my neck muscles in the back were kind of stretching, and all around were kind of stretching to get me back up. So I was feeling that kind of muscle strain, but no pain at all from the incision, from the plate that he put in. I was kind of surprised about that, but I was happy. I have broken bones and pulled ligaments, and they were much more painful than the reactions I had to the surgery a couple of days after I had been home. My surgeon recommended no surgical collar. He said the titanium plates that they use now hold enough support. He didn't want any artificial support. Like I said, it was 2 weeks ago yesterday that I had the surgery. I had some surgical mesh that he put on there that was kind of sticky, so it was kind of grabbing the lint and stuff from my shirt and the sheets and sweatshirts and stuff. So we took that off. It was mostly falling off anyway. We took that off after about the second week, and I switched to Scaraway. A friend of mine recommended to this after her husband got the surgery. It comes in a bigger box. We got ours at Target, These are the little strips. They're 1.5 by 3. They have some adhesive kind of on the back you peel off. And literally you just peel it off and you stick it on there. They're washable, which I thought was kind of gross, but I have one strip supposed to be good for 7 days, so washing it was fairly easy. It dries overnight. They recommend you don't wear it at night. It dries overnight, and you can stick it right back on. It's got the same adhesiveness that it had almost the first time I stuck it on, so I was pretty surprised to hear that. I came from the pharmacy today, and at night she recommended Mederma, which comes out of, it's kind of an oily cream to put on at night, which I have kind of on there right now. She said that's the kind of the best treatment, and then after that tube is done, that I should switch to vitamin E cream. So again, I had ACDF 4, 5, 5, 6, 6, 7, no surgical collar. I'm 2 weeks post-surgery. The doctor gave me no restrictions. Said do what you can do. Don't overdo it. So everything's working out well, and I hope you have kind of the good experience that I had with my surgery. Pay attention to your body and take the meds as you can. But again, they didn't agree with me. That was one of the things. We lost about 2 days of recovery time, but once we figured it out, good to go. Back to work. Good luck.